Hi, I'm Janet Jaffe, clinical psychologist, here to talk to you about my new book, Healing from the Trauma of Pregnancy Loss. If you are watching this or listening, you or someone close to you has suffered a loss that is heart-wrenching and deeply, deeply painful, and for that, I am so sorry. This truly is a loss like no other. I've been working in this field, helping patients get through this kind of trauma for over 25 years. And in my clinical experience, I know how pregnancy loss can shake the very foundations of your life. I know this not just from my clinical work and research, but I too have dealt with my own reproductive trauma and know from the inside the struggles to grieve this kind of loss, the lack of support you may feel, the stress on your relationships, but I also know how to get through it and grow from this kind of loss. The notion of the reproductive story, I talk a lot about this in the book, and it has helped so many people understand why pregnancy loss and or infertility is such a trauma. Simply stated, the reproductive story is about all of your hopes and dreams about having children. What this book focuses on is when those dreams turn into nightmares. Let's think for a minute about the role of stories in your life. We all have stories to tell about things that have happened to us in our past, things that have happened to us today, maybe something at work or a conversation that you've had with a friend. But we also have stories about our future, how we hope things will go, how we hope having a child someday will fit into our lives. The reproductive story is also a story about the future. In essence, it is what we wonder it will be like to have a family of our own and become a parent someday. Sometimes we think about it consciously, like maybe what we want to name our children, or how many children that we want in our lives. Sometimes it's unconscious. It's more like just knowing that it's going to happen someday, that this might be something that happens. The really interesting thing about the reproductive story is that it starts very, very early in our lives. It starts when we are children ourselves. And this is one of the reasons that when it doesn't go the way we had hoped or planned, it's one of the reasons that it's so painful. It's because it's so deeply ingrained. Here we can see kids playing and imitating what they see the adults in their lives doing. In this picture, we see a child who is mowing the lawn, and you can see in the background the adult that he's imitating. This is a picture of a doll. You are probably all way too young to know about this doll, but she's called Betsy Wetsy. And this was the beginning of my own reproductive story. She came with a bottle that you could fill with water. She would cry real tears and she would wet her diaper. And the advertisement says, you too can become a mommy with Betsy Wetsy. It's old and I'm old, but you can get an idea of how it affected little girls growing up. Sometimes people think that it's only little girls that have a reproductive story, but little boys do too. And here in this picture, we can see a little boy who's nurturing a baby doll. But sometimes kids will just gather sticks, and there'll be a mommy stick, a daddy stick, and a baby stick. Sometimes it's toy trucks, stuffed animals, anything that kids can make families. Everyone has a reproductive story, regardless of your race, your religion, or your sexual orientation. Even people who don't want children go through the process of answering the question, what's it going to be like? The focus of the book is what happens when these dreams and thoughts of the future turn into nightmares. What happens when the story takes a really heartbreaking turn, whether it's because of infertility, miscarriage, stillbirth, or other pregnancy loss. These events are so traumatic, and not only can they be physically traumatic and medically traumatic, but they are psychologically traumatic as well. Essentially, the reproductive story and all of your hopes and dreams about the life that you had planned have been shattered, and it affects every aspect of your life. Here you can see in this graph, it affects your sense of self. That's right at the core of what is going on with a reproductive trauma. You may feel damaged. You may feel like you can't trust your body. You may feel a sense of guilt, like, what did you do to cause this? I've known people who thought it was those groceries that I carried. They were too heavy. I know some people who were convinced they had some junk food, some Skittles, or a Diet Coke, and that's what caused their loss. We know this is not true, but it can feel better to find some blame somewhere rather than to not have anything to blame. Some people really feel shame from these losses, that maybe something in their past has caused what they're going through now, what you're going through now. It also affects your intimate relationships. How does your partner feel about you? How do you feel about your partner right now? Are you grieving the same way? There are so many different ways to grieve, and they may be so different from each other. It's true, too, that family, friends, and coworkers may not understand what you're going through and try to fix it. They may offer you advice that is well-meaning for sure, but so off-putting. They can say things like, "You can have another. It was for the best." And we know that this was not for the best. We do live in a child-centric world, and the message that we get often is pay no attention to those feelings. Pull yourself up by your bootstraps. You're going to get through this. But what you are feeling cannot just be pushed aside. You need to grieve. And this book will help you guide you through your grief. It will try to answer so many questions that you have, like, how do you grieve a death when there should have been life? How do you grieve when your baby or your hoped-for baby was only alive in your heart? How do you grieve a negative pregnancy test? How do you grieve when you are trying again? How do you grieve when there are really no rituals or so very few to guide you? This book offers practical advice in how to create meaningful rituals for yourself and your family in getting through the grief. It also suggests exercises for you to do, and even though you may really want to isolate and move to a deserted island, I focus in the book on how to navigate through holidays, birthdays, dinner parties, and other social events that can feel absolutely overwhelming. But let's focus back right now on the idea of stories again. Here's the thing about them. They all have a beginning, a middle, and an end. This is true for the reproductive story as well. We know, as we've just talked about, that the beginning starts in our own childhood. The middle of the story, that's where you are right now. And you may feel so stuck in the middle. What will life look like if my reproductive story can't find resolution? I can assure you that it will. And whether your story ends with children or not, my hope is that this book will help you navigate through this pain. You can think of it, I do, as a kind of a companion. when you maybe are up in the middle of the night and you feel alone and you just need to let out your feelings. I know that this book won't take away all the pain, but my hope is that it will help you heal through the trauma of your loss. Thanks so much for listening.